In other news, for the second time this year, clinical officer interns took to the streets today at the Ministry of Health and Social Health authorities. The clinical officers accused the government of failing to pay them for 7 months. And the clinical officers are also complaining of harsh conditions in the hospitals, conditions that take a toll on their mental health. Anna Dida with the details.
As the dust settles on yet another confrontation between healthcare workers and the ministry, one issue stands out starkly: the controversial rollout of the Social Health Authority SHA.
They have not sent any formal request to us to relook at some of the clauses.
Sisi tuliandika notice ambayo tuliweza tukawapa na ishafika. Mimi najua ilifika.
Clinical officers and health workers across the country are bearing the brunt of this new system, which they claim was hurriedly imposed without the necessary groundwork. For the clinical officer interns on strike today, SHA has become a bitter symbol of unfulfilled promises and systemic failure.
Sisi ambao tunasaidia binadamu ama tunasaidia wananchi wakapate kukaa vizuri, inakuwaje kwamba sisi ndio tunakuwa wakaza kukandamizwa?
The Council of Governors Health Committee chair added his voice to the ongoing crisis, cautioning health institutions at both the national and county levels against turning away patients due to system challenges.
Mekuwa na tabia mahospitali zetu za serikali, hospitali zetu za binafsi ambayo yote saa hii inatumia hiyo bima, kwamba mtu akiingia saa hii na kwamba hajamaliza kujiandikisha na hako mgonjwa zaidi anatumwa nyumbani. Tumesema kama serikali hiyo ni hatia.
However, according to the chair of the Health Union Caucus, Peterson Washira, SHA's allegedly chaotic introduction has left many health facilities clueless about its operational framework.
I've refused to register over 1,000 private facilities that are registered by the Clinic Officers Council and owned by clinic officers. And the facilities I'm talking about, these are the facilities you find in Turkana, in Lodwar, in the hardship areas.
For the clinical officer interns, the struggle goes beyond administrative blunders. A palpable sense of frustration hung in the air as they took to the streets for the second time this year. What began as a fight for placement in hospitals 7 months ago has now evolved into a struggle for basic dignity and survival within their workplaces.
It has been a very rough time without it. Some of us have given our grievances of feeding with patients, having to sleep with the patients, because we have been chased out of our houses by the landlords.
This unfolding crisis comes just a month after the appointment of the new cabinet secretary, who now faces immense pressure to restore order within the healthcare sector. Governor Njuki, while drumming up support for SHA, urged for patience as the ministry works to streamline operations and resolve emerging issues. Ann Odida, TV 47.